Hello, and welcome to the third annual LGBTQ plus Elder Housing Services Virtual Symposium, produced in collaboration with SAGE, the national advocacy and services organization that's been looking out for LGBTQ plus elders since 1978 and made entirely possible by the generous contributions of the Harry and Jeanette Weinberg Foundation. My name is Ephraim Getahun. My pronouns are they and he, and I am the Director of Strategic Partnerships and Training at Open House, which is the LGBTQ plus senior center in the heart of San Francisco. And I am privileged to be your host and moderator through this four-part series for the month of September. Founded in 1998, Open House works to center the voices and experiences of LGBTQ plus older adults by providing opportunities to make social connections and build community. Open House enables San Francisco Bay Area LGBTQ plus seniors to overcome the unique challenges they face as they age by providing housing, direct services, and community programs, a unique lunar cycle of support that sees our elders through their aging process to live and thrive in the communities they helped build. We recognize and affirm that LGBTQ plus older adults live at intersections of race, ethnicity, class, culture, HIV status, sexual orientation, gender identity and expression, spirituality, and ability. At Open House, everyone is a community member. Before we begin, I'd like to acknowledge that I am joining you today from the land of the Ramaytush Ohlone people of the San Francisco Peninsula, originally known as Yalamu. We recognize that this land is the traditional, ancestral, and unceded territory of the Ramaytush Ohlone people, and we honor their enduring connection to this place. As we come together virtually for this event, let us also remember our collective responsibility to support and uplift Indigenous communities worldwide. Please reflect on your individual relationship to the land you occupy and consider identifying local voluntary land taxes as a small step towards repair of the atrocities committed against Indigenous communities in the states. Some housekeeping before we begin. Please note we will have live English and Spanish captioning provided by Interprenet. Additionally, live ASL interpretation made possible through Interpret That. For any issues experienced, please utilize the chat feature to communicate to our team, and we will address concerns to the best of our ability. Thank you. Throughout the series, community advocates, housing, and aging experts and service providers will come together to discuss the housing service needs and models to equitably address LGBTQ plus aging in housing. Each week, a range of experts will discuss specific challenges facing LGBTQ plus elders of color, various service and housing models to address disparate aging experiences, and unique community-based solutions for the holistic health of LGBTQ plus communities in housing. These four sessions will go beyond the brick and mortar to discuss the implementation of holistic care for LGBTQ plus elders to age and thrive in community. Now, on today's symposium session, Collective Resilience, Sharing Space to Age Together. The compounded isolation facing LGBTQ plus elders has been magnified by the COVID-19 pandemic, which is particularly challenging for trans elders and elders of color. At this time, living with other people poses a promising opportunity for elders to affordably age in their homes. From an activist-driven approach to community housing to various models of home sharing, come learn about ways elders can maintain independent living amidst interdependent systems by learning about the housing and support services of Pittsburgh's Sisters PGH. Today's session will include a presentation following an audience question and answer Q&A. So please prepare your questions using the chat feature at the appropriate time so we can read your messages aloud. I would like to introduce today's session speakers, Ciora Thomas, who is a Pittsburgh native. She is the executive director of Sisters PGH, a nonprofit organization she founded in 2013. With firsthand experience as a teenage homeless sex worker, Ciora recognized the lack of opportunities for Black trans adolescents to thrive independently within a system that perpetuates transphobia, drug addiction, and youth homelessness. Sisters PGH is dedicated to advocating for social and economic justice for transgender and gender nonconforming BIPOC individuals in Allegheny County. The organization operates Pittsburgh's only trans-owned community center, offering tangible resources such as rent and utility support, medical and mental health referrals, self-affirming groups, and various programs. Ciora's leadership has been instrumental in bridging the gap between transgender and cisgender communities, as well as building equity and mutual aid platforms for trans people. Additionally, she is the founder and lead organizer of People's Pride PGH, an annual event that aims to center and protect marginalized LGBTQ+ communities in Pittsburgh. Ciora holds several local and statewide positions, including the first Black trans woman to serve as chair of the LGBTQIA Advisory Council of Pittsburgh and on the Pennsylvania Commission of LGBT Affairs. She advocates for LGBTQ+ sexual and domestic assault survivors. Ciora has received numerous accolades for her outstanding service and leadership. I am honored to bring Ciora to the stage. Thank you for being here, and the virtual stage is all yours.
Thank you so much. Thank you so much for having me. It's truly an honor to be here. Definitely want to give love to Sage and Open House for continuing to do this. It's truly important, to those around the world that are experiencing these disparities. So thank you. So today we are going to be getting into housing and what that looks like for us. I'm going to talk a little bit about myself after we just heard my long bio, but and then we're going to jump into some collectiveness. And I welcome all questions that you may have to come through. Time willing, they will be answered. So again, my name is Ciora Thomas. I am the founder and executive director of Pennsylvania's only Black trans woman-led nonprofit organization that is based in Pittsburgh, that is working at our capacity, providing these tangible resources and housing initiatives for our transgender community of Pittsburgh and Allegheny County and southwestern Pennsylvania, to be quite frank. It's an honor, to continue serving in this capacity, coming into this work as a teenager, right? And now being here as our organization continues to thrive. So I'm happy to be with you. We'll go along and get into it. Next slide. So of course, just some traditional ground rules I like to set when I'm doing any type of speaking or trainings. Speak and listen with respect. Next slide. Meet people where they are. And step up, step back. And lastly, hold questions for pause breaks. In this situation, we're going to hold questions to the end, and I'll be able to answer all of the questions that come through. Thank you. Next slide. So just a look ahead of what we'll be talking about. So we've gone over this, Sisters PGH, and who we are and what we do, the housing crisis faced by our trans elders and how we can fight it. So again, who is Sisters PGH? So we are a Black and trans-led 501c3 nonprofit that serves queer, trans, Black, Indigenous people of color in southwestern Pennsylvania. And I'll touch on this, and I talked about this earlier. This is really important to note that in Pennsylvania, we have a Black trans woman-led nonprofit organization that is working at our capacity to serve our trans communities. And while we are based in Pittsburgh, we ultimately serve Pennsylvania. There are folks that move to Pittsburgh, to get our services, even from outside of, Pennsylvania, especially if this Roe versus, or especially as these things are happening in Florida with DeSantis. We see a lot of our trans siblings wanting to find respite, and we're also trying to take on, that as well. So when we say this, it's so important to know how Pennsylvania is set up, how we're still, functioning, but struggling at times to function as a Black trans woman-led organization. My board of directors, we are, Black women, and I'm the executive director and founder as a Black trans woman, right? So this is a monumental thing that is happening in, Pennsylvania, and inspiring other groups, other Black trans-led groups and organizations to want to also do this work. And we need that, right? We need the collectivity of other Black trans-led groups. So I wanted to touch on that just so, everyone's aware. Next slide. So what do we offer? So at Sisters PGH, one of our biggest programs, one of our biggest programs is Project T. So this is Pittsburgh's Translate Transitional Housing Program, a radical vision of self-determination and housing justice. This is a program that we created the programming because we are trans people who experienced homelessness and houselessness. So we know exactly what we need. It has always been beneficial for the community that is experiencing the harm to lead in the way of servicing, especially if we want to get into this work. I happen to, want to get into this work and work alongside people who also are into this work. So we sit down and we create this programming amongst ourselves and with those we serve, right? We talk about these statistics and data, that's generated from this type of work. But we actually have those that we serve and those with lived experiences adding on to these programs, and specifically Project T programming. Yeah, that's where we are. That's Project T. So a little bit more information. It provides a safe space for unhoused and trans and non-conforming people to reside while working toward their goal of independent living. And it gives them time for respite from the streets of housing instability and a space to prioritize self-care. It provides stipends for personal items, transportation, and small bills like phone service or car notes or whatever our siblings need while inside of our transitional housing program. These monthly stipends have been monumental to the support of those coming into this program. Access to our list of locally available TGNC safe rentals. So we've done the due diligence over the years, and we actually, myself included, call around our local area to landlords to find affirming, safe, affordable housing for our trans siblings. It's one thing to, get a list from someone who may not, have taken the time to vet who these people are, and if it's a safe housing situation for our trans communities, or you're running into a slumlord who doesn't care who lives there as long as you give them the money. And what I believe and the values of our organization is that trans people, we should not have to just live in poverty out of circumstance. We should be able to be safe, be secure, and live luxurious if we can. And lastly, access. We take that back a little bit. Access to a list of our TGNC affirming healthcare providers. This is another vetting process. I have numerous meetings with local providers, national providers who can provide, telehealth service, just to find some adequate services for our TGNC Youth Collective, our TGNC community of Pittsburgh. Right now, our medical spaces, they're still in a learning phase, and myself and I've heard from a lot of our SIBs, we're feeling very guinea pigged. And I use that word loosely, but that's just like testing to see if this works, see if this space works. And while that is happening, and while that may be good at times, it's also bad for us who are experiencing the lack of actual trans affirming spaces, medical spaces. Next slide. So here's just a testimonial of Selena B. She was actually at our Project T program and graduated our Project T program. And she had mentioned being Black, trans, and disabled is very tough living in America, especially Pittsburgh, to be more specific. In my lowest of times, Sisters PGH came through for me and helped me get back on my feet. Thanks to their program, Project T, I was able to have shelter and build up funds for housing to better my living situation and gain full independence. I am very grateful for the work you ladies do, and I appreciate everything you have done for me. Wishing you nothing but the best for our trans sibs and hoping more and more lives can be helped and impacted by the work that Sisters PGH does. Thank you and much love. Things like that, especially as a founder, seeing these testimonials, it makes this work so much worth it. On those hard days, nonprofit work is not easy, but when we are able to have our siblings graduate through these programs, youth, adults or seniors, graduate through these programs and find their own independent living, it makes this work even more worth it. So I appreciate seeing these all the time. All right, so another program we provide at Sisters PGH is rent and utility support. While we do provide, Project T, we would much rather our siblings, if they already have stable housing but can't afford that housing anymore because of the increasing cost of living and the gentrification, in our area, if we have the funding to support them, we're going to keep them where they are. Because of the history of low wages and employment discrimination faced by our LGBTQ communities, our elders find themselves becoming particularly vulnerable to housing instability. And I'll add on to that, in where I live, there's not even a conversation that outside of the conversations we have at Sisters that even consider trans elders, and on top of that, Black trans elders, within our area. Continuing, these wage and employment discrepancies show up clearly in retirement savings. Members of the LGBTQ plus community are less likely than straight Americans to have a 401k and are able to save less on their overall paycheck. Also, according to a recent report, 50% of single LGBTQ plus older people believe that they will have to work well beyond the retirement age, compared to 27% of their single non-LGBTQ plus peers. And 51% of LGBTQ plus elders are very or extremely concerned about having enough money to live on, compared to 36% of non-LGBTQ plus peers. And that's something really, really to think about when we're continuing to have this conversation. Next slide. A little more, what do we offer? So we discussed this written utility support. And again, being committed to providing solutions to our clients by way of programming specific to housing insecurity and necessary utility payments. Our rental assistance program provides emergency payments to save them from evictions and prevent utility shutoffs. So, how does equitable employment play into this? So because of the low wages for nonprofit work in Southwestern Pennsylvania and work period, particularly LGBTQ employees are unable to thrive while doing vital work for community. Statewide, the average pay for those, and we're going to talk about nonprofit work specifically in this section because this is how we show up. This is how we can continue to build community through those having, other community siblings and members who want to also be a part of this work. I'm a firm believer of it takes a village. So statewide, the average pay for nonprofit employees is about $18 an hour, while our main salary at Sisters PGH is $22 an hour. Access to equitable opportunities in employment make it possible for employees to better resource in their daily lives. Access to benefits, services, and ability to afford nutritious meals can increase the lifespan of employees. We just started hiring folks. I want to say around three 3 or 4 years ago. Even myself, being officially hired as the ED maybe about 4 or 5 years ago, where I received my first salary. And as we continue to, go down this lane and compare the market rate in our local area, we're in the housing, the rent and the utilities just increasing and increasing. Uh, we definitely put into mind how we are going to equitably pay those that work at our organization, to make sure that they have, some sustainability. And actually, just today, or my leadership team, board of directors, implemented a 401k for our staff members, which is huge. If you're thinking about especially Black women, Black trans women, in this work, who some make a career out of giving back to our communities. It's huge for us to have these type of benefits while doing this work. So that's something else we offer. Next. So a few other things, and we'll get into it. We offer is Marsha's Closet. Of course, it's named after our matriarch, Marsha P. Johnson, and this is a space where our trans siblings can come to access affirming clothing. This clothing comes from donations from community, directly from community, who want to continue, pouring into Marsha's Closet, making sure those that, don't have their affirming clothing or need new clothing can come into this space and get free clothing, right in our community center in Pittsburgh. Another program that we have is the TGNC Youth Collective. So this is a collective of young Black and brown trans people who are essentially learning from the years and years of service that I've put in Pittsburgh, Allegheny County, and wants to further that, wants to continue that. I'm getting older, right? And as I'm seeing our young people activating and getting into the work, providing a space that they can lead within as young people is super, super important, for our organization, even for the future of our organization. When I'm no longer the executive director and the CEO, or, whatever happens, that our young people have a platform to always feel comfortable to lead within Sisters PGH. And the TGNC Collective is a cluster of that. Emergency housing, I've talked about this, a few times. We continue to provide emergency housing and shelter for those who need that, those who may not be eligible for a Project T program, or those who are, need to get out of a crisis situation, but need some emergency housing. We are able to provide that through partnerships in community, as well as, paying for hotels, but providing that direct service from our staff. So not just putting our folks in hotels, but, actually supporting them while they're there so they have a plan when they move out. Our drop-in center, we have the only trans woman-led organization in Pittsburgh and Allegheny County that is exclusively for trans people to come get resources. Yes, they can come, they can bring their friends, but the services inside Sisters PGH are for trans women, trans men, and non-binary people that are in Pittsburgh and Allegheny County. They don't have to be from Pittsburgh and Allegheny County. If they happen to come, or visiting, or happen to stumble upon and be in Pittsburgh, they are able to utilize our resources. Another program that we have is our name change project. So this is another one of those situations where, marginalized communities doing the work for us in providing these direct services. The name change process can be a process for those of us that have gone through it or going through it. And to be able to provide the financial resources for those who may not be able to afford a name change, directly through Sisters PGH, is a holistic way of, supporting our communities without the red tape. We don't want anything, folks through any of our programs, but to succeed and, get what they need. And this program specifically is their name change. And lastly here, People's Pride PGH. So if you're from Pittsburgh, if you're from Allegheny County, you have heard of People's Pride PGH. This started as a protest against the then Delta Foundation of Pittsburgh that was extremely just racist and segregated our communities. And not only that, took away so many financial resources from our LGBTQ community that could have been put to good. But instead, it was put to the pockets of most of the leadership, there. So we started this Pride Festival that centered the lives of Black and queer trans people in Pittsburgh and Allegheny County. At this time, I was a board member of their LGBTQI Advisory Council, the first advisory council Pittsburgh has, or LGBTQI Advisory Council that Pittsburgh had under the then Mayor Bill Peduto. And so I partnered with them and with our team that we had, and we started, this Pride Parade and Pride Festival that garnered thousands of people. I thought it was just going to be us and the girls out there just, screaming and hollering and raising our flags. But thousands of people, came out who were tired of the segregation in Pittsburgh, who were tired of the racism, who were tired of the lack of support for Black, trans, and queer people in Pittsburgh. And because Pride was never just a festival, just a good time. This is something we have to, take serious, pay attention to legislation in our areas, pay attention to the elected, if they're doing their job, what we elected them to do. And if they're not, we need to call them out and continue doing that through these Pride festivals. And what started out as a protest advanced on into still a protest, but an annual event that centers the lives and experience of Black trans people in Pittsburgh and Allegheny County. And that's something I am extremely, extremely proud of. We've been able to garner hundreds of relationships locally, throughout the state, around the country, about People's Pride, those who wanted to start their own, People's Pride in their areas. So this is something that has been truly influential to the city of Pittsburgh and Allegheny County when it comes to inclusion of Black and brown, trans, and queer people. Thank you. Next slide. So we'll see the questions for the end. I think that's how we had it set up. All right. So what's needed? So more street outreach, trans-competent transitional living programs, and other housing programs and services should be free of bias and harassment and provide access to culturally competent services that affirm LGBTQIA+ identities. Traditional shelters should transition to non-traditional and offer transitional housing programs to help curb and end a homelessness crisis. I think we all know, and especially those in this work, that the shelter system is not good for houseless people, how it's set up right now. If they were able, our community and those that serve were able to transition those services to actually provide programming and services for our houseless communities, they can actually advance out of that. But what happens is these spaces continue to be open because of poverty, and that's not okay. Next. So, a way to do this: analyze how staff are screened before being hired into these spaces. Provide professional development for current staff. Care must be trauma-informed. It must be trauma-informed. Connect youth to community resources and services that are affirming and safe. The nonprofit industrial complex, it makes it not safe for young people because, folks are literally fighting for bodies. I've learned this before I even jumped out, just to focus on Sisters PGH. I worked for other nonprofits that went against my values, right? As a founder of an organization. And for me, this work is not just about the bodies or recycling of homelessness, recycling of poverty. It's about actually giving them support to push them outside of poverty so that they are able to live independently and no longer need these services. And another way you can do that is expanding public awareness about queer youth issues and decrease stigmas associated with their identities. Next slide. Excuse me. So another thing that can be done on the criminal justice system. So Black and Latino people, with a disability and members of the LGBTQ plus community are disproportionately represented in the criminal justice system. This is especially true for trans people and queer women. And while incarcerated, these individuals are subject to particularly inhumane conditions and treatment. These formerly incarcerated people also then typically return to low-income communities where affordable, accessible housing is scarce. There is currently a national shortage of 7 million affordable rental units available to extremely low-income people. And in my humble opinion, that's just ignorance. That's pure ignorance of, those in power just not caring about the people. Next slide. So criminal records. For LGBTQ plus people, with a criminal record, discrimination based on their record combined with already high rates of discrimination can make finding employment and housing even more challenging, especially if they're a felon. So given the harassment, violence, and disproportionate discipline that queer students experience in educational settings, combined with the high rates of discrimination in the workplace, programs that allow those with a criminal record to pursue education are incredibly important. States commonly place some restrictions on the ability of people to change their names due to the concerns about fraud or invasion of law enforcement. For trans people with criminal records, these restrictions can create hurdles to rebuilding one's life. Now, legislation like the Fair Chance Housing PA Senate Bill 912, where it states federal, state, and local laws provide only a patchwork of protections against discrimination, and none of them consider that many trans and queer folks have criminal records simply because trying to survive. They also do nothing to protect us from abusive landlords, building managers, and housing authorities. And we have to be very specific when we're talking about the LGBTQ community. While we are a community, there's an intersectional difference when it comes to trans people and when it comes to LGBTQ or LGBTQ cisgender people. So paying attention to those intersectional differences and seeing how the trans community is far more marginalized than the LGBTQ cisgender community. It's a huge thing. Now, parole reform is something that is hugely needed. Once released from prison, if someone is placed on parole or probation, they're often required to adhere to a strict and unnecessarily burdensome requirements and regularly meet with a parole or probation officer. There have been cases in which a trans person dressing in accordance with their gender identity has resulted in a violation of parole terms. There has also been situations that I can speak from experience, doing this work, where parole officers are being inappropriate with our trans girls and women, in these spaces. And when I say inappropriate, I mean sexually inappropriate with those that are already going through, a bad time in their life. And, they're taking advantage of that. I've had to have plenty of conversations with the supervisors of parole officers who are visiting our spaces or, interacting with someone that we're serving. And it's crossing the line of being a professional and a service provider to someone who really, could utilize these services. Next slide. Now, travel limitations can be particularly onerous for trans people and people living with HIV, particularly those in rural areas. Those folks may not be able to access competent, respectful medical care. And I touched on this earlier, but without traveling. Next slide. So discrimination protections. Now, codifying into law protections that prevent queer and trans discrimination by landlords and create a clear path for appeal for people who have faced discrimination. Improve statewide anti-discrimination laws to protect justice-involved people from housing and discrimination. And pass statewide source of income protections that preclude discrimination based on government assistance, supplementary income and occupation. Now, expansion of affordable housing resources and cultural competency is huge. Increase in the PA budget allocated to address housing in PA, specifically to increase the availability of affordable housing and governmental assistance available to renters and homeowners. And ensure government housing program staff are trauma informed and trained in how to safely interact with members of the queer and trans community. I can express how time and time again, even through our rent support program, how we are dealing with transphobic renters, or the neighbors are transphobic, or the community that they're living in is transphobic. So it's important for all of us to do our due diligence, when sending and providing our communities, with this housing. Now, sorry, go ahead. We'll go to the next slide. All right, and I think that's the end of our session here. And just some sources that I got some of my statistics from: the National Coalition for Homelessness, the William Institute, youth.gov, the University of Florida Office of the Lesbian, Gay, and Bisexual, Transgender, and Queer Affairs, and justia.com. And now we will open the floor for questions.
Thank you so much, Sierra. Honestly, your expertise is so invaluable. So often I think we have to confront the fact that many of the models, especially for queer elders or trans individuals, there isn't a model that's been created. And so often, there are maybe many dead ends, or many trying to pivot to answer this immense need. And so, your model is incredible, because what you guys have started in Pittsburgh, having this replicated and then even become more specific to elderhood in trans experiences, it's a really powerful thing to think about the ways housing developers that may be attending this presentation, or advocacy groups or other nonprofits, can think about the models that you have designed, maybe working with you to replicate them in their specific regions. But there are a few things that you touched on that I kind of want to parse out a little bit.
Yeah.
I think one thing that was really powerful was you kind of touching on the mirrored experiences across this parallel timeline, right? You mentioned how there's policy in the works in various parts of the states, like in Florida, and how oftentimes I think our Black trans siblings are the ones that end up kind of dealing with the brunt of this. And I wonder, are there things that you're noticing that are being perpetuated today in that political front that we know we have dealt with historically? What are those things that you're noticing? And because we know Black trans folks deserve more and deserve better, is there a call to action that you have to the wider audience to kind of address some of the tides that we're noticing starting to turn again?
Mm-hmm. Yeah, so I'm noticing, my gosh, as a community that is becoming used to, and I say used to because trans people have always been here, but as a community at large that is becoming or seeing trans people actually lead in sustainable ways, there's this moment of having to learn and not flim-flam the work, actually having to be trained, actually having to be respectful, actually having to pay trans people equitably, within these spaces. So I'm seeing that happen. And I mentioned that a little bit earlier. That does not mean, just because these things are happening, doesn't mean that people are still being harmed. Because our siblings are still being harmed during these processes of learning. How do you house trans people? How do you provide adequate medical care for trans people? How do you provide, support systems for trans people getting out of jail? How are these things happening? And my call to action to that is provide the resources for trans people to do the work. We can do the work to provide the resources for our community if we actually had the equity to do that, for our trans community. I find that, and we've heard the term gatekeepers, we've heard the term, people holding on to all the funds and we can't get to it to provide for our communities. That's the call to action. Be willing, if you're a cisgender led organization and you have a trans program, be willing to put all your money where your mouth is when servicing trans people. And that means by hiring someone that's trans and paying them above the market rate, not on the market rate line, above market rate, so they can be sustainable in community and not need the program, not need the housing that the organization is providing, as well as understanding that we are the most marginalized within the LGBTQ community. So if you are an LGBTQ organization, understand that, and that's okay. It's okay for us to work in tandem together, without you having to feel like you have to take care of us. We call that infantilizing. That does not have to happen. Trans people are strong enough to stand on our own 2 feet and provide for our communities because we understand exactly what our communities are experiencing, along with our allies. And I'm not saying our allies are not needed. Our allies are certainly needed in this work. But the biggest thing that can come out of it is equity for us.
Period. Thank you so much. That was a beautiful answer. I see some questions coming in from the audience. And before I get them, I just have a few other things that I wanted to kind of like parse even deeper. You had talked a lot about so many of these programs that you all hold. Already naturally, elders are going to be captured throughout this work, right? In order to have a niche trans-specific aging organization would be an incredibly niche project, and there aren't enough initiatives out there. So naturally, your work grabs onto elders.
Absolutely.
And so I think it's important for the audience to think about what elderhood looks like in the trans community, because elderhood may look different. It might be defined differently. The ways that we turn towards wisdom of our elders in the trans community might also look different. So are there things that we need to consider about what aging even looks like in the trans community?
Specifically where we are, because we serve trans elders through our organization, through our housing and our programs. And how I look at, again, as a founder, I look at our elders as our matriarchs and somebody I am supposed to support, supposed to be there for. And, through the access of my organization, of course, we are due diligent in making sure that our elders in Pittsburgh and Allegheny County, as long as we have the resources and access to support them, that they want for nothing. That we're even in conversation of having, a senior living program, for those in our area, because while we do provide, housing at Project Peace, particularly for our elders, we have to understand there are intersectional differences while we're also doing work with trans people, right? And while we might have, young people, 22-year-olds in the house, those that are aging, that may not be the environment for them. So finding equitable spaces where they can flourish while are aging. And I think that's something we're tasked to. I'm a millennial, so I think that's something we're tasked to, as this generation of leaders and, nonprofit founders, is to find ways that we can also equitably support our elders, whether they're in this work or whether they're not in this work, but so that they can live a long life, because we deserve that.
Yes, absolutely. Thank you so much. I have a question from the audience, and someone prefaced it with, I hope this doesn't come off as ignorant, but they said, this may be a little ignorant, but is it okay to approach aging trans community equally? Meaning, I don't want to assume the experiences of the individual, but I do want to keep in mind their marginalization. Any suggestions on how to approach this fairly?
Read that again for me.
No
Let me
problem.
absorb that. Let me absorb
Yeah,
that.
yeah. And it's really a question. It's interesting because they're worried about coming from a place of ignorance, but they're actually equipping themselves with a really culturally humble way to ask,
That's
which
what I was
is
hearing. Right.
yeah, which is great. So I appreciate the preface, but it wasn't. I don't think it was necessary here. Which the question essentially is it okay to approach aging trans communities equally? Meaning, I don't want to assume the experiences of the individual, but I do want to keep in mind their marginalization. So, are there any suggestions on how to approach them fairly?
I mean, I think this person's answering their own question. I think, as you were typing the question out, the juices were flowing, and you started to
Mhm.
answer your own question. And I think that's by, paying attention, keeping in tune, with our elders, asking questions.
Mhm.
Even as trans people, like, yeah, I'm a trans woman, but I don't know everything, about trans people and what their individual needs are. This I always refer to myself as a student of leadership experience, because people throw that leadership title on you and uphold you to all these, things. But I've always been a student of leadership experience, meaning I'm going to ask the questions that I don't know. So that's what I would give to that. Ask questions, be informed, and continue to move like that. So we're
Yeah.
not in a space of I know everything. We never will.
Yes, exactly. And I think even to your point, like, yes, they actually did answer their own question because it's the assumptions that cause the harm. It's the assumptions that there's this blanket experience for all trans individuals, and or assumptions that stereotypes are the ways to lean into the work. And so moving away from those assumptions, I think also ultimately, you know, these conversations can provide a lot of best practices and support, but each individual's like authentic, genuine connections with individuals out in their own real life.
Right.
Um,
Right.
establishing those connections, learning from those individuals, and those natural relationships will foster,
Exactly.
or it will at least inform the way that you move through community. Because there's that
Mhm.
like cultural fluency, that kind of like there's like a key that gets unlocked when you're building these actual legitimate bridges in your
Mhm.
interpersonal connections with people. So that's always really
And
powerful.
even just a small addition, we use all these fancy words when we're doing stuff like this, but there's actually a real life thing happening outside of these, situations where language is going to even look different,
Mm,
when talking to communities. So, and I'm always aware of that. Being a student of leadership, I'm learning these new phrases, I'm learning these new words, I'm learning how to walk differently and move differently. And just
right.
because I have doesn't mean my sibling has. So me always, meeting us where we are in that moment, is super important too.
Mm, beautiful. I have another audience question. When developing elder housing services, how can we establish trust with trans elders to be able to best represent their needs?
Let them lead. Allow them to lead the space. Don't assume that this is the best thing for them just because it's housing. Allow them to lead in the space. I
Mm,
found that to be very beneficial to our elder communities, which builds relationships. As we continue to move on with this work. And that's what I holistically believe in, is letting them lead the space, tell you how it should be done and how it should be set up. And yeah.
yeah. Yeah, it's really interesting because, you can always build something and it's completely different if people are going to come. And I think for in a way, it may be it may be in the best interest of folks that are interested in serving, the trans community and opening up their space and or moving out of the way for the trans community
Yeah.
to
Yeah.
think about the debt, right? Like there very well may be, many opportunities of trying to build bridges that people will not take, and
Right.
rightfully so. There is a significant history of harm and or mistrust that has been sown. And so if you are an organization, a nonprofit, or a housing developer, social services organization, whatever it is, if you are now beginning to think about the people that are not at your table,
Right.
there may be a long time before people finally pull up a seat. And so being comfortable with that, that desire to advocate and be there and do the work, and understand that there's going to be some discomfort as you're organization better fits the culture that trans folks need for them to even approach you in the first place.
Yeah.
So I think really investing in that work. I don't know if you have any other comment around that, but I think that's a really key piece that people miss often.
Yeah, you hit it right on the nose. I mean, there are plenty of people with good intent, with access to money, with access to housing, with access to all these things, but they don't have the lived experience to know how to serve this community, serve
Mm,
our community, and it's okay to step aside. If the mission was for you to come in and support a community, giving them the full reins to do so is the best thing that you could do, with some support, of course, but giving them the full reins to make our dreams a reality, to create that generational wealth that we talk about for trans people. That's
mhm.
going to be it. That's going to be it, because we have not lived that American dream. Black trans
Right.
people have not gotten that. And again, even within our LGBTQ cisgender community, because there is privilege of being a cisgender person in society, and there is a lack of privilege of being a transgender person, navigating society. So as long as we're having you're putting those things in tune, when your way of thinking, when you're doing the work, it'll get done.
Yeah, absolutely. Thank you for that. It's so interesting because I think when we're thinking about the privilege element of it, it's so much more than just like I mean, the harm and the violence are significant, but then there are so many of the nuanced elements, like
Oh
the
yeah.
ways that people are kept out of, services, the barriers that exist. Um, or even something as basic as like the traditional family structure
Right.
and the ways that wealth are inherited. I mean, home ownership, we all know it. It's the number one way that wealth is being passed down from
Yep.
generations. And if you are a queer person who's excommunicated from your family, and then more commonly a trans individual who may be pushed away from your biological family, that there's already, even if home ownership was a thing, I mean, even
Hmm.
if to even say if that's a huge assumption to even think that that might even be the
Hmm.
case. But um, the breakdown of that quote unquote traditional family structure keeps people out of the kind of um, source of wealth that they could
Yeah.
have inherited. Oh,
And,
go ahead.
and I was going to add, that's exactly why us as Sisters PGH, we are buying property. Like Project T, that's our house. That's going to be forever Sisters PGH's housing, supportive services. We own the house and the land around it. And we're moving forward and doing that in Pittsburgh. I can't say too much because my board will be like, girl, we're going to tussle after this. But these are conversations that we are continuing to have, of buying homes, apartment buildings, and doing what we want to do with it, because we'll be, historically the homeowners, and we'll never sell to a gentrifier. I
Right.
talk to a lot of housing developers in Pittsburgh. I've even had recent meetings and I went into the conversation, looking for support. And how can I, for example, how can I buy this block of dilapidated, rundown housing and get it up and running? And I remember having a conversation with this guy, cis man, um, and he said to me, yeah, there's so many crackheads in the neighborhood and prostitutes, and he used these words, and prostitutes in the neighborhood, and we want to make sure that whoever's buying the property, doesn't have to deal with that. So we want to make sure that you. And I lost them there. I lost them there because these are my people. These are my
Mm,
people that you're talking about, and I'm sure that relationship could have been fruitful, but I'm talking to a white cis man, first of all, and I'm talking about buying property in a historically Black neighborhood. And the nerve to say that to me was just eye opening in that moment of, how people view us, how housing developers even view Black people within our own neighborhoods, that they come in, and gentrify and doesn't make it better. Promise the people you can come back once we fix everything up. We're going to fix it up for you and you can come back. And that never happens. So it's just these are also, things that we are navigating, while doing this. And I
Yeah.
feel that it's important to say, if there's anyone in the room today who may be a housing developer, your relationships are going to matter, historically in our neighborhoods. So just keep that in mind.
Yes, thank you for that word. Absolutely. Thank you so much, Ciara. I have another audience question. And this one's a pretty unique one, and I actually really appreciate this. It's asking, there has been growing conversation around developing multi-generational housing for LGBTQ plus communities. What are some of the benefits or challenges that you've seen in multi-generational housing services for trans communities? So we can start first with the benefits, and then we can talk through the challenges.
Yeah, I think the benefits would be, there would be somewhere that our LGBTQ, seniors could go, to live out their days comfortably and happy, as they should, as we all should, right? I think that's
Mm,
a good thing. Um, the leadership is what would I would look to see what the leadership is that is building this, this generational housing for our LGBTQ communities. That would be something I would think of. And I would also, listen, I'm just going to be frank. We've had trans people attempt to live that are houseless, attempt to live with other houseless, or folks in need of housing, LGBTQ folks. LGBTQ folks can also be transphobic. And I want that to be very clear as we talk about, these, combining housing or combining shelters or combining spaces, that trans people are not safe all the time in these spaces. 9 times out of 10 are not safe in these spaces because we receive discrimination, from also the LGBTQ cisgender community. And if we are not actually understanding what that looks like, you're moving
mm,
kind of blind to how, trans people actually need served, within the community. So these are just some other points that I would bring up. I
yeah,
think it's great. We need it. Yes, we need it. But how it's structured is super important. It's super important.
yeah, yeah, absolutely. And then can you tell me some of the, did we say challenge? Did we do challenges or
Oh
benefits?
yeah, those were the
Yeah.
challenges.
Yes.
Yeah.
So the benefits. Yeah, the benefits. Thank you. So do you want to walk through some of the, because those were some challenges, some of the benefits
Yeah.
that you've seen?
Oh yeah, I was saying it could be a good thing, especially within community. And I can elaborate some more. Especially in communities where this is not accessible, where this is not a thing. This is something that people are not having conversation about because, queer people are the last thing on a lot of these folks, developers and, other queer servicing or cis servicing nonprofits. Like, they're not thinking about us, in this work. So it would be incredibly influential, to the lives, of LGBTQ people, having to live under these circumstances.
Mm, yeah, absolutely. It's really interesting because I think like ultimately intergenerational queer housing, it would, and if it works, it answers all of the issues that we have. We talked about this traditional family structure that we don't get to benefit from.
Right.
Many of us are not connected to our biological families, and that's not necessarily the story of everyone, right? Not all queer trans
Right.
people are like dealing with the same narrative, but um and so ultimately these intergenerational models are seeking to replace what our biological families, right, what our chosen family can step in and do on behalf. And so it's really important, I think, what you had mentioned when it comes to the L, the G, and the B of the community, how we have continued to perpetuate the same harm that cisgender straight counterparts have done, right? It's like, I think because we have our own experiences, we have our own marginalization, it makes this assumption that we are not contributing to this
Right.
and not actual participants in the same transphobia. So I really appreciate you naming that and pointing that out directly.
Yeah, because if we don't, we're still going to be moving on in life like everything is rainbow and glitters within the LGBTQ community, and it's not. It's not.
Mm,
Trans people are actually like just being extremely harmed and tokenized and used, not paid enough to do the work. Like I can go on and on. You know,
yeah,
I
yeah.
see. I lived it. And I'm seeing others, live it, working for nonprofits, making $10 an hour, doing extremely hard work, and important work. But it's just we gotta think about that as we
Yeah,
move along.
yeah, absolutely. Thank you so much, Ciara. I have another audience question. As a non-LGBTQ plus organization, how can we provide safe space for elders who may be transitioning in their later years? And that's an interesting question because many of our elders, of course, didn't necessarily have the same opportunities
Right.
to transition outwardly if that's something that they
Right.
even desired in the first place. So yeah, that's a very interesting question. How can we provide safe space as a non-LGBTQ organization for folks transitioning later in life?
Yeah. First of all, making sure that whoever's working in that space is competent. That trans doesn't have a look. Like we don't have to be passable.
Hmm.
We don't have to look like cis women and cis men. Like that's not a thing. That's something that was made up by colonialism. So making sure that we understand that, trans people show up in many different ways. And how they show up is going to be us. That's how we're going to show up, but making sure that those that are providing the service, those that are providing the resource, to our elders, that are transitioning in later years are supported, holistically supported, not just trying to, check a box, but like actually like, what do you need, Sid? How can we support you
Mm,
in like being intentional about those relationships, not becoming someone who's serving community from an Eiffel Tower, right? But actually invested in making sure that their experiences and needs are met. In a way, and I said this earlier, you can do that by asking, by having conversations. What do you need? And not putting that data up on the shelf to collect dust and be asking that same question a month later, a month or two later, when you already have the data here because you did a study on what they needed. A while ago, you did a couple of studies, a while ago, but actually utilizing the data that you collected and putting it to good work.
yes, absolutely. Yeah. And it's really that last piece is so important. Data is so boring. I know. Oftentimes we just like gather this information because we assume that it's going to be useful to some degree, but we make specifically trans individuals invisible in
Yeah,
data. It's
yeah,
not that they don't exist.
right.
It's not obviously that these needs are not, substantial, but when we are not even collecting the appropriate data or collecting SOGI data like sexual orientation or gender
Or
identity data
census.
collection or census data, and building the bridges because of the mistrust for collecting this data in
Yeah.
the first place, and then pushing past your own provider discomfort of asking those questions, making these individuals invisible through research. They're not invisible, but we are making them so. So
Right.
that data collection and then actually using this really valuable data is important because data points lead to advocacy, which literally translates to the physical dollars that any one
Mhm.
organization might be getting from their city or their state or the nation.
I'm glad you said that because I had a gripe about the census. The last one we did was Census 2020. I think that's the last one we did around
Mhm.
the country. And they're not collecting data about trans people. And as a trans organization, how do we benefit from those census dollars if we are not counted on the census, while we are serving the trans community? So we become ineligible for those
Mm,
funds, non-trusted for those funds because the government is not acknowledging that and even though we're a 501c3 organization that files our taxes and do what we got to do and, does all of that, but we are not even recognized, or are given the opportunity to receive those funds because of the transphobia within the system, of this data collecting. So That's another point.
Mm,
A lot of us trans leaders around the country had a huge gripe about when Census 2020 came out. Like, y'all are not counting our trans kids. You're not counting our trans adults or seniors. Those disabled, like there are so many intersections that you're not counting
yeah,
when it comes to trans people. And that was a huge problem, with the census. So
yeah.
sorry I went off on a tangent, but it had me it
No,
had me
no,
years ago.
it is really important because even here in San Francisco, like there's this assumption that because we're like where the LGBTQ like kind of like um uh, culturally in the world, there's this assumption that San Francisco is the epicenter
Right.
of
Right.
everything that is queer, which we
Mhm.
obviously know is not true. But even here, there's a recentering around specifically SOGI data collection because of how abysmal that collection is,
Right.
not only in the state, but here in the city of San Francisco.
Wow.
And so when we go out and we provide these trainings to these providers, so many of them, the number one thing that they say is that people are upset that we're asking this information. But there was a study that was done across the entire West Coast, this healthcare or uh, company, I guess, a hospital network, I should say, had done a survey and found that only 3% of the patients were actually in distress when these questions were being asked. It was 97% of the providers that were asking the questions that were uncomfortable. So there's a
Wow.
very clear disconnect
Right.
in where we think the struggle is. It's not
Yeah.
people receiving these questions and being asked them. They might be confused and might have some questions, but it is the provider discomfort in
Yeah.
asking. And so, as a
Absolutely.
provider, as social service organizations, we have a duty and responsibility to make sure that we're adequately collecting this information so that
Absolutely.
organizations like yours can actually be funded correctly.
Right. It would help a whole
Yeah,
lot.
I know it would. I
Because
know it would.
Pittsburgh, our region got a lot of money, a lot of
Yeah.
money. The money was being passed out. And we're looking at that and we were distraught. We were distraught. We were just like, we could have done so much good that these experts, and I use that quotations because we have become the experts of,
Mm,
in our areas, trans leaders within our areas. And, we run into folks that maybe some experts in some fields, but when it comes to Black trans liberation and housing and needs, and stuff, we have become the experts in this. So it's just we're trying to get through it. We're
yeah,
trying to get
yeah.
through it.
And we have to help you. So we have to. If anyone's listening and is in a position
All
to
help
be,
is appreciated.
yeah, I think we really underestimate our individual participation. But
Mhm.
it is a bunch of individuals participating in this bureaucracy that makes it very difficult for organizations like Sisters PGH to do their work. I have a few more questions. One of the questions specifically touches again on the intergenerational element. What are some things that younger trans and non-binary people can do to engage with and support their trans and non-binary elders in their community?
Oh, I'm gonna use I statements, right? Because I can't speak for everyone, but what I can do is use the platform and uh, resourcefulness of my organization um, to create space for our trans elders to thrive within. Right, where I live, that's not a thing. Like they in Pittsburgh and Allegheny County, they're more used to us just being dependent on these very a few LGBTQ orgs who hardly serve black and brown queer people, right? And so while I'm here now, growing my organization, what I can do is continuing to have that a part of the conversation. I'm about to turn 35. This is even the time where we're expected to die. Like we shouldn't
Mm,
even live past 35, right? And so that opens up a lot of other conversations when we're talking about aging within the trans community, because this is the age that we should be being killed or dying, within community. And to be able to have our elders live beyond these ages, we should be there to be able to support them. And there's also, let's be frank, right? There's generational differences in conversations that need to be had within the trans communities. I've never been the type to be on a platform understanding that we should be having trans conversations amongst each other. We should be having conversations where we're invested in, where we're not the pony of the show for the rest of the folks to be adding their opinions in, because we see how everything else has boiled down, how our data has been used, how our bodies,
Mm,
lives have been used. So we need to have intergenerational conversations amongst each other to see how we support each other holistically within this work. So those are a few things, and
yeah.
just being there, even when it's hard, to be there, right? Just being there, for our trans elders and not allowing them to fall through the cracks, because without their experiences, without their lives, we would not be walking as comfortably as we do around society right now. So
Mm,
all just understanding like their sacrifice, no matter where they were in their life, they existed. They existed. And that gave me the ability to exist in front of y'all today. That gave a
mm,
lot of us, younger trans folks the ability to live. And although we're going through so much discrimination and so much hatred and so much violence, right? There was also a time where you cannot walk down the street, and that's still hard. But there is a an educational situation that has happened generationally that has taught the larger society that trans people do exist. So we can trot around a little lighter, a little lighter than we could,
mm,
in our elders' younger days, right? So
yeah.
um, being cognizant of that.
Yeah, beautifully said. It's amazing because I stumbled on a job for this organization for open house just randomly on an Indeed page. I had never put together LGBTQ plus and senior together in my mind. I had never seen myself as an older person. So that just literally was not a concept I could have conceived on my own. And so the minute I saw that, the awakening that I felt in my spirit, I think for many of us on the younger end of the spectrum, genuinely don't even know that the community is there and starving for this connection
Yeah,
with the youth. And there are many reasons why this massive chasm exists generationally. There's a lot of loss that's been experienced. There are maybe sometimes cultural frictions or differences or tugs that pull us in different directions, but ultimately most of our elders, I would say, are hungry for this connection, both at a
absolutely.
spiritual and an emotional level, for youth. So if you are a younger person who happens to be trans or non-binary and are just also realizing now, maybe for the first time, or generally have been thinking about this hunger to connect with your elders, there are many organizations, I'm sure, including Sisters BGH, that would be interested in volunteership. Are there any volunteer work that can be done both locally, but also maybe virtually that they can support at Sisters PGH, for example?
Yeah, that can well, our website is a great place to go to find those things. But there's always listen. We need all the help we can get in Pennsylvania, and I
Mm.
say that I say that in a very serious manner. People don't understand that we are dealing with excuse me the south of the north in Pennsylvania, and a lot of us around the country fail to realize how this particular state, I don't even know how it's blue, but this particular state is literally the South, and we call it Pennsylvania, we call it the South of the North. We have so many names, for Pennsylvania. But we can use all the help we can get, at Sisters in supporting our communities. I have a small but mighty team, right? And we're trying to expand our resources to be able to hire more people, because volunteering is great. Yes, we love to have volunteers, but I would love to hire people that are
Mm,
competent to the work, who want to make careers, out of this, because volunteering is great. It's wonderful. It's love and light, but people got bills to pay. And that is the reality of it when doing this work. I see a lot of our siblings who want to get into this work, right? And I want to be able to provide those employment opportunities for them, these different opportunities. So that's the biggest thing, that we can use and support.
Mm,
We're maintaining where we are, right now. And we have folks that are coming in, helping us work with those that we serve, our elders, all of those. But, I mentioned earlier, it takes a village. It really takes a village.
yeah,
And when we're doing this, just staying in tune of what's happening with us. We're always putting out a press release. We're always, throwing something out, just paying attention to that and, doing whatever you can to be supportive. If you're in Pittsburgh and you want to go, carry some boxes to our storage facility, we are here for it. There's a lot of situations or a lot of opportunities for, volunteering sisters as well. But I want to hire folks. Where I want to get into the phase of where we're providing equitable jobs for those that are wanting to come do the work for this type of
yes,
organization in Pennsylvania.
yes, beautiful. I have another question from an audience member, from Al Cunningham. He has an interesting question, or excuse me, they have an interesting question. If trans people are being discriminated against by LGBT organizations, do we need to stop lumping them together?
Yes, in short term, when you put, and I'm so glad you asked this, because I've had conversations, so I'm comfortable in saying we. I've had conversations with other trans leaders around the country about this very topic. And when you lump the trans community, which is a gender identity and not a sexual orientation,
Right.
it waters down the experiences of trans people. It no longer makes us legitimate as a gender identity because we are within a sexual orientation spectrum. I always, when I'm representing the LGBTQ community as of some years now, I always say TLGBTQIA, just to understand that there is a difference. Trans people can be LGBTQ or LGBTQIA as well, right? So there is a difference when we're having these conversations, but I think not separated, but an understanding of,
Mm,
this is a community within these sexual orientations that is experiencing far more discrimination than their cisgender counterparts. So, making that very, very clear. We're not trying to play trauma wars or trauma Olympics is what they call it. We're not trying to do that. We're being very intentional about who's actually being served correctly. And we can even
mm,
look at this in a historic manner from our perspective. With Marsha P. Johnson and Sylvia, our siblings died homeless with no resources after fighting for so many years for the gay liberation rights movement. And they died homeless and with no resources. You can literally watch the biography of Sylvia
mm,
and see her living outside in a tent, or in a makeshift space, her safe space, which is good, but in the reality of it, not enough was done for our trans elders, even in those times, by
mm,
the LGBTQ cisgender community. And I don't say that as with a separatist tone. I say that as the access and privilege that was gained from these women's fight and scream was not reciprocated. It was not
mm.
reciprocated, and that they did not receive their just due. So while we are here now, don't you think their daughters, granddaughters, and them days, and trans boys and men deserve that same type of support generationally?
Absolutely.
We call that reparations. um, so
Absolutely. Yeah, I really, really appreciate what you've just offered there. I think I think unfortunately, so much of our community does struggle to understand the differences between gender identity and then, of course, our sexual attractions. Because curious enough, Any variety of gender identities can be any or all of the sexual
Yeah.
orientations. And so I think what's really powerful, even when I was reading your biography, or your bio at the beginning of this, even small language changes, like bringing that T right to the front, right? That's a very
Mhm.
small lexicon style, like
Mhm.
unlocking that can happen there,
Yeah.
by framing, because our language is incredibly important. That's why we're desperately trying to find language all of the time to continue to describe this incredibly elusive human spiritual experience.
Yeah.
And so really
It works.
thinking, yeah, thinking deeply about the ways, that small things that you can do in your fluency, in your cultural fluency, to signal to trans communities that this is a place that's working on it. Harm is going to happen. It
Yeah.
is literally inevitable. And I think people that have a mentality that we are going to figure out how this harm is not going to happen, that there's a problem in that thinking. And so it's
Mhm.
not so much about the harm's not going to happen. What are the systems in place to repair?
Yeah.
What are the systems in place that believe trans individuals? And when you're talking about the experiences generationally of trans individuals, I mean, we have trans elders here that talk about the AIDS epidemic, for example,
Mhm.
and it's a very different story from what our
Yeah.
cis gay,
Yeah.
elders have talked about. And the trauma and loss that our cis gay men specifically has experienced is more immense than anything that I can possibly comprehend. And yet our trans elders will tell us, yeah, well, at least you were in the room. At least you
Yeah.
got into the hospital. So many of our trans elders weren't even allowed to come in to receive the care that they so desperately needed. So many of their,
Yeah.
some of our trans elders talk about their trans siblings literally dying in the streets. And
Yeah.
so and again, this
Another.
is not the Olympics. It's not even about pitting it in that way, but there is this unique experience that this sect of our queer population is experiencing, and we have time and time again either ignored it or just kept it out of our mind or said not yet, which is the most dangerous part, and
Yeah.
why this movement continues to fail is because of the not yets that we have
Yeah. I
instead.
know. In my like where I live in Pittsburgh, when I get the opportunity to sit down with a trans elder from Pittsburgh or Pennsylvania, I truly turn into like a 5-year old, and I
Mm,
sit there and I want to listen and I want to learn like about the experiences because we are so isolated from our own communities in a way in Pennsylvania because what Pittsburgh and Allegheny County has become good at is disenfranchising us, putting us together against each other,
mm,
and completely erasing trans elders when they age out of nonprofits. Um, you know, and when I get the chance, especially as a young woman doing this nonprofit work, feeling so isolated because there are no other organizations working at our capacity, um, and not being able to go to an elder and be like, I'm struggling. Like what was happening, with your experience then to what's going on now. It's so limited in our areas. But when I do get that moment, because I can't do that with those that we serve, I would never, go to someone who's coming into our housing programs and be like, tell me your life. I would never do that. But,
yeah.
those who have been in the work before, who allow space for that conversation, I'm just always so thankful,
Mm,
to hear that because it's so isolating, being this individual that is, growing this organization without an elder support to lean back on.
mm,
And that is culturally needed, for us young folks to thrive, to like know how we should move. Like, yes, I had these experiences, so I know how to move with some of these folks, but culturally, is so important, for us and to be able to continue to provide and hold those conversations and spaces is going to be super beneficial. Not just going back to that other question, it's
mm,
going to be super beneficial for us. We need
yeah.
that. We yearn for that too, that generational connection, with someone who lived the life way before we lived it, right?
Yeah.
It's valid.
Yeah, that's so so beautiful, Sierra. I'm so grateful that you said that last piece. You know, I just want you to know, ultimately, you deserve more. You deserve to have an elder to be able to show you this, and for you to be able to lean in on that. And while you're obviously going to be resilient and continue to have to be, I hate that you have to be in a world where you have to be in the first place. And
Mm.
I am also excited that there will be younger trans individuals who are coming up who will have you as an elder one day,
Mhm.
to be able
Yeah,
to lean in on, so we're so grateful for that work. I also, just as a note, very personally understand Pennsylvania. I was born and raised in Lancaster, Pennsylvania.
oh yeah, so you know.
So
You know.
so I know,
Mhm.
I know, and I
Mhm.
deeply, deeply understand it. And that just, to me, again, it just hits a little bit deeper, the work that you're doing, and I understand the significant, barriers that you're sometimes having to come up against. And so, yeah, this has been an incredibly beautiful presentation, Sierra. Thank you so much for the conversation that ended up coming up afterwards. Do you have any last thoughts or concerns, or just words? The one other thing I do want to say is that there is someone named Doria in the chat that says thank you so much for doing the work. And so I just wanted to definitely end with that. And yeah,
I
if
love
there's
them.
anything that you wanted to say.
Of course, thank you all for having me, Sage. Thank you, Sage. Thank you, Open House, for having me. Thank you, everyone who attended and registered for this session to listen to a Black trans girl from Pittsburgh, Pennsylvania, talk about my experiencing in housing and nonprofit building and support of our elders. We have to really. I'm speaking for home and maybe anywhere else, but we have to decolonize the colonization that we were taught as people.
Mm,
And in order to do that, it's going to take so much more of us having these type of intentional conversations to actually eradicate the colonialism that we are essentially surviving through. And to know while that may be hard, it's worth every little step that you can and are willing to take to make that happen. So keep going, keep feeling empowered, um, keep feeling loved on. Because
mm.
there are those of us who care and love you, the same. And if you're in Pittsburgh and Pennsylvania, and you need a space, we are here for you.
Mm.
So
Beautiful,
thank you.
beautiful. Thank you again, Ciora, for your contribution today. It has been so invaluable, and your experience, your story, and the work that you're doing. I'm just so grateful for you. So thank you
Appreciate
again.
y'all. Mm.
So that concludes this insightful session of the Open House LGBTQ plus Elder Services Housing Symposium. I want to express my deepest gratitude to our incredible speaker, Ciora Thomas, for sharing her expertise, experiences, her wisdom. Your words have been incredibly transformative, and we are honored to have had you as our first speaker in this 4-week journey. I'd also like to extend a heartfelt thank you to the teams of Interprenet that provided invaluable captioning services, and of course, Interpret That, who ensured that our event was accessible through American Sign Language interpretation. Your dedication to accessibility is deeply appreciated and makes it possible for a broader audience to engage in these important discussions. Additionally, a special thank you to our partner organization, SAGE, for their unwavering support and collaboration throughout the symposium. Together, we are making a significant impact on the lives of LGBTQ plus elders. Lastly, I want to acknowledge the generous contribution of the Harry and Jeanette Weinberg Foundation that made this symposium possible. Their commitment to supporting initiatives that benefit our community is invaluable, and we are grateful for their support. Remember, your registration for this symposium grants you access to the following 3 sessions, the next 3 Tuesdays in September, which will take place every Tuesday at 11 a.m. Pacific Standard Time, 2 p.m. Eastern Standard Time. We have a lineup of incredible speakers and topics that promise to deepen our understanding of the housing challenges and opportunities facing LGBTQ plus elders. So mark your calendars, spread the word, join us next week for another engaging session. Together with the support of partners like SAGE and organizations like Interprenet and Interpret That, we can continue to build a more inclusive and affirming future for LGBTQ plus elders. Thank you, and see you all next week.